department reported 5,400 new COVID-19 cases today. That is the highest since August last year.
The OCTA research team reveals that the Philippines' reproduction rate is growing faster than expected.
It's spreading more quickly, and we believe that the variants are partly responsible for this fast surge, because we haven't seen anything like this detail, not in the entire history of our pandemic in the Philippines.
COVID-19 cases continue to rise in the country. The government is encouraging the public to be vigilant in wearing face masks and observing other minimum health protocols, even at home.
Ang konteksto po ng question na yun ay baka po dumating tayo sa panahon na pamilya na ang nagkaka-COVID. And in fact, we are now in that situation. Face mask tayo. Only if we are confident na wala tayong COVID, that's the only time na wag po tayo mag-face mask.
It's been 1 year since the Philippines went into one of the longest lockdowns in the world. But it looks like an anniversary. It's taking a turn for the worse as the Department of Health logged the record highest number of COVID cases today.
We are also back to imposing strict lockdown measures as the 10 p.m. curfew starts tonight, but with the surge of cases and the slow vaccination, are the same restrictions from a year ago still effective to contain the transmissions? We discuss in this episode of the Chiefs.
Welcome to this Monday edition of the Chiefs, or should we say anniversary edition of the Chiefs, the first anniversary of our lockdown in Metro Manila. And of course, with us tonight, on set is Robbie Lampay of One News. Also joining us online is Lucy Cruz Valdez, the head of News 5. Joining us in a while will be Ana Marie Pamintuan of the Philippine Star. Lucy, Robbie, happy Monday.
Magandang gabi.
Well, not really.
Not so happy anniversary.
Yung mga story mo kanina, hindi masyadong happy eh.
Oo, nakakabigla naman talaga. And I think the number is there precisely, I mean, not to shock, it is shocking, but I think obviously it will have that effect. Our headline today, 18,000, that's the projection. We have to stress, that's a projection for mid-April by OCTA research.
It's a mathematical projection based on the trends. If the trend continues, and that is the projection that they expect to reach.
And we have to stress, OCTA has already raised its projection for March, I think 3 times over the course of the past 2 weeks. From 5,000 to 6,000, now it's 8,000. They're projecting by the end of March.
So, as it turns out, conservative pa pala sila, no? Sa lagay ko yun. And everybody was saying nga parang, sobra naman yan, sobra. But really, as it turns out, they're not only validated, they're more than validated. Taas, grabe.
Alam mo naman, Pilipino, mahilig sa mga record-breaking na bigas bibingka, bigas longganisa, ngayon, longest lockdown.
Ipasok na natin yung because I think lahat tayo maraming tanong sa guest natin.
Yeah. Well, we begin tonight with Dr. Beverly Ho, the Director of the DOH Health Promotion and Communication Service and Disease Prevention and Control Bureau. Doc, good evening and thank you for joining us, and welcome to the Chiefs.
Good evening. Thank you for having us.
Thank you po for joining us. Well, Doc, let me start off with this. Of course, the numbers, the increasing numbers are a concern, but let me zoom into one particular concern, especially that came out over the weekend. All these reports of hospitals with their COVID capacities full daw in Metro Manila, in particular St. Luke's, Makati Med, Cardinal Santos, Medical City, Asian Hospital, and even QC General. But at the same time, and we understand, you've been quoted as saying na mababa naman yung hospital occupancy rate sa Pilipinas. Well, nationwide, 35%, if I got it correctly. And Metro Manila is at 49%. But can you reconcile the figures for us? What are we, I suppose there's some misunderstanding on how we read the figures. So tell us what it really is.
Yes, so as I was referring to the interview earlier this morning, so we know that that's the overall picture for the entire country, but obviously it's very different within NCR, no? So within NCR, we know that as much as 60 to 70% of most of the COVID beds have already been occupied, no? So we are either on red, no? So high risk or actually very critical risk already in some of our hospitals in Metro Manila.
So totoo po yung reports na these particular hospitals talagang they're full to capacity na.
Yes po, no? So, but still, we did still have some of the hospital who are supposed to dedicate their beds for COVID that haven't done so. So, yun pa rin naman po yung perennial issue natin, di ba? And also, we note that since the hospitals are now opening up to services outside of COVID, the usual beds that they can allocate for COVID, they're no longer able to do so. No? So ito din po yung last year, a lot of the surgeries, for example, or procedures were halted, diba? Because may voluntary na nag-stop din yung hospital to give services, to give way for COVID. Now, because of the positive developments nung first 2 months of the year. So then the other medical procedures started happening na rin po.
I mean, Doc, bottom line, kaya pa ba? I mean, how much more, if any, or at all, can our hospitals, both public and private, take?
I think at this point in time, it has to be very clear to everyone that the larger the number of cases we have, that the percentage or the number of the severe cases which will occupy the hospitals will always be a part of yung malaking number na yun. No? So the bigger the number of cases, kahit 2% lang yung severe or critical natin, it will amount to huge number of people who will occupy the beds. No? So hindi na po talagang kailangan po nating mag-ingat, practice the minimum public health standards on an individual level and our family. The industries, the establishments have to enforce the engineering controls, and the LGUs also need to do their part. No? So if we keep on doing what we're doing, then the assumptions may come true. No? So the only way to make that untrue is for also us to significantly change the way we behave now.
Okay, Doc, let me ask it again. Are we near to another timeout or to calling for a timeout?
I think how I'd like to answer your question is we will need the timeout if we don't change what we're doing now. So we've seen na naghigpit na po yung LGUs, that's good. We're seeing less people going out. We've seen establishments going back to, work from home ulit yung mga tao nila. No? So these efforts, we're hoping, will add up to the positive response, no? Para mag-plateau na tayo.
Well, Doc, you also mentioned... Sige, Ruchi, go ahead.
Yeah, ako, Doc, apart from a lockdown, is there anything else at all that we can do to stave off the 18,000 projection?
Absolutely po, no? So we did that. That was part of the code protocol last year, di ba? Coordinated operations to defeat epidemic. So at that point in time, when we had the timeout, we had to make sure that the LGUs were doing active surveillance, di ba? Yung difference po niya is that you're actively going house to house to look for the cases already and bring them to isolation facilities. We also have to understand that there's very little incentive for daily wage earners to actually have themselves isolated voluntarily, di ba? So, kinakailangan po talaga may effort to bring them to the isolation facilities and also the ayuda part, no? Or taking care of their family while they're actually unable to earn.
Naku, teka muna, but is that really, first of all, is it doable, no? Magiging, ano na naman yan, sapilitan, tapos sumbungan na naman yan ng kapitbahay. I mean, you know, yan yung nangyari noon di ba? Parang...
we're literally back to 1 year ago.
Really. It's now, short of saying talaga, police, di ba, control. We're under some kind of police control.
I think we have to understand it as it's not coercive, no? It's actually facilitated lang. Kasi if you're from a low-income family, how can you actually transport yourselves without exposing others? You will likely need to do public transportation, di ba? Second, nagsasabi tayo, it's very easy for us to say, okay, within the household, medyo separate tayo kumain, etc. Don't mix. But for other people, that's actually not a luxury. They all live together. So kung sino yung laging lumalabas, siya yung exposed, paano naman niya mapoprotect yung iba na nasa bahay niya? No? So parang, I think we have to look at it also in a more holistic manner that many people cannot, maybe it will be impossible for them to realistically perform the minimum health standards just because of their situation.
So pero when you think about it, okay, the OH is saying that for every positive person, there should be around 30 people that should be contact traced. Now, I think ang equivalent din yan, halimbawa, in a workplace is pag may isang nag-positive, you're going to have to close down entire units and departments just to be able to contain the virus, no? So, di ba parang ganun din, para rin tayong bumabalik sa lockdown situation, in a way.
Wala pong shortcut, no? And wala naman talagang shortcut dito. The real public health measures are such, and that's why we're really being challenged na you crush the clusters as early as possible, di ba? You allow a situation wherein people are really able to say they're not feeling well, they will not go to work, and they're not going to be penalized for it. Otherwise, it's really going to be a chain of situation that will lead us na mas mahirap na siya i-control or mas malaki na yung cost.
Let's bring in Ana Marie Pamintuan of the Philippine Star. Ami.
Good evening, Doctor. Doctor, may mga report ngayon na yung mga private hospitals daw, they're running out of emergency room capacity. Saka yung iba namang hospital, yung mga local government in Metro Manila, yung mga COVID bed capacity daw nila is fast running out. Kaya ba nating makontain to? Kasi ang OCTA research, ang warning nila ngayon, if the trends continue without sufficient intervention, baka daw by April 15, 20,000 cases per day ang mararecord natin. Is that a realistic scenario? Saka kaya ba natin na mapigilan yon going there?
So we have to exert all efforts. Admittedly, because there were good numbers in the last 2 months, there was more confidence to go out. And admittedly, our data also shows a little bit more lax, di ba? And then, we also sabay yung economic reopening, which is always a part, as you will also see it in other countries. It's a normal thing, no? And hindi naman po talaga, as you will also see how other countries have done it, it's not always a one-way street lang, diba? You will really ping-pong between one state to another. So it's really how well we are able to flexibly adjust at every stage. No? So at this point, ma'am, we do think that when we strengthen our public health measures, we do it consistently and correctly, a lot can actually change.
Pero
So you're saying kaya natin. You're saying kaya natin kasi ang bagong factor ngayon are the new variants na actually hindi pa fully acknowledged ng ating public health officials. Parang hindi pa fully factored in na this is the one that actually fueling. You're not even calling it a surge yet. Kaya ba natin ma-contain?
No, it's still part of the previous, diba? As WHO has already said it to us, no? So this is not a new one. This is still a continuation. of our second surge. But I think what we need to understand is the variants or the virus that carry the variant, their passport is actually the breaches in protocol. Diba? Hindi naman po bago yung mechanism of transmission ng variant If you don't have breaches in protocols, the virus also won't be able to transmit or move from one person to another. So it's the same interventions that we need to do. It's only that we can't afford to be relaxed.
Well, Doc, I think what everybody wants to ask is policy-wise and intervention-wise, is everything already in place to stem the rising tide? Itong unified curfew, yung constant reminders ng protocols, social distancing, pati yung public displays of affection nga kasama na dun sa listahan So policy-wise and protocol-wise, are things already in place or do we need more? Kasi nakakatakot po talaga yung 18,000. Parang that's kaya ba yung stem with what we have in place right now? I think that's what we all want to boil down to it.
So ngayon po, we all really have to work together. It's not really an LGU work lang. The workplace that have started opening up, the establishments that have started opening up, we met them kanina po this afternoon to talk about possible additional solutions, no? Or ano ba yung nandyan na, pero kailangan lang i-ramp up, di ba? Then the individual level, it's not only communication campaigns that will need to work, they will have to be supported at the community level, di ba? So the provision of masks have also started again today, and I think face shields soon as well, no? So there has to be support mechanisms that have to be provided pa rin po. But in general, I think they will also announce minimizing the number of travelers that will be allowed to into the country as one of the mechanisms also, because we know that a large part of the new variants that we're seeing are also brought about by travelers din po.
Ma'am, but what about yung, I think part of the confusion sa mga tao is malinaw. When you talk to the individuals, it's very clear what they need to do. Malinaw din sa mga individuals what they need to be afraid of. But I think at the national level, they're a bit confused because the signaling also over the past few weeks is parang the national government was quite slow in acknowledging what scientists and experts were saying na wait, iba yung yung transmission rate today. It's a totally different game, and therefore we know we were headed into a reopening of the economy. We were getting that confidence, and it seems as if the national government seems to be reluctant in acknowledging that call for a more nuanced messaging on do we reopen the economy more aggressively or not.
I think at this point, the government tried, at least the health and the economic sectors tried to meet a middle ground. But our role in the health sector is to always raise the red flag, right?
Yes.
And really make sure that at all levels, people can act, no? So some LGUs still continued their very strict measures, diba? Despite parang standard general loosening up in the entire country. So sa amin naman, our job remains the same. Raise the red flag as early as possible.
Do you agree that, si presidential spokesperson Harry Roque called the efforts of the government excellent, actually, hindi raw palpak. And until March, or the beginning of March, the government was really doing excellently. What are your thoughts on that? Did the government, in your opinion, exert all that it could given its limited resources, or it could have done better? And if so, where exactly did the government lack in doing something, whether it's ordering the vaccines early enough or calling a spade early enough? Because we remember a year ago when people were already talking about COVID spreading in other parts of the world, we were so lenient here, and it took a while before we finally, it blew up in our faces because a COVID positive actually died, right? So when you look back at that experience, I'm sure Filipinos will say, ayan na naman kayo, may variant, pero ayaw nyo pang tawaging variant. Ayan na naman kayo, late na naman mag-order ng vaccine, and now we're facing this, it's not a second surge or a second wave, we don't want to call it that. So, and yet on top of all of this, Harry Roque says we did excellently. Your thoughts?
First of all, Miss Lucci, I just wanted to clarify, no, it's not that we don't want to call it a variant. We're sticking to science, and science tells us it's still not a variant of concern, no. So if we do get the notification from WHO that it is, then we call it as it is, no. It's not something naman na tinago natin, no. So we're saying as it is, we stick to science. Second, I think I've been in the health sector personally for the last 10 years. And so I've seen how our frustrations within the health sector before the pandemic. No? So I think dapat klaro yun sa atin. We didn't have a perfect health system when we started the pandemic. We didn't have the investments that were needed, and there were challenges in terms of governance within the healthcare system. It is devolved, no? Unlike many other countries where you don't have as much fragmentation. That said, I do think, and this is me as a public health physician and also as someone who's dedicated into this field, I clearly believe that there's always room for improvement in all that we do, diba? The Filipino do deserve better, but we also recognize that there are resources that are limiting us from getting there, for giving them the best care. But also, when we zoom out, we also need to know that it's not only our healthcare system that's encountering this many challenges, no? So even the most established healthcare system in the world actually are grappling with how to manage the COVID-19 pandemic. So no excuses, no, we always could do better, that our people deserve better, and we as healthcare practitioners know that our people deserve a different level of standard, and we will, as much as we can, try to achieve that.
Doc, speaking of limited resources, kanina we were talking about bed capacity, ICU wards, and so on. What about human resource? How are we doing with regards to the number of doctors and nurses that we have?
So currently, we're because of the added financing that we have gotten from Bayanihan, we've been able to temporarily expand our health human resource pool. But I think this goes beyond just this pandemic, no? Kung pag-uusapan talaga natin siya, talagang kulang po yung plantilla positions, for example, in our local health units. Diba? And that is actually the big strain factor in our LGUs having functional epidemiological surveillance unit, and them having sufficient people to man their rural health units or their district and provincial hospital. So hindi po natatapos yung laban with this, parang inflow of cash because of the pandemic. I think we need to make sure that our decision makers continue to look at health investments as equally important even after the pandemic. Kasi hindi po dapat ngayon lang siya na importante. And with that, sir, you would know that pinakamatagal pong investment sa buong health sector yung pag-grow po ng human resources, no? Ang tagal pong magpaaral ng health human resource plus the expertise. So it's something that needs a long-term investment din po talaga.
Doctor, isa na lang, may suggestion ng member ng OCTA, one of the members lang naman, yung one time, big time daw, two-week lockdown to coincide with the Lenten break.
2 week, Holy Week.
2 weeks na Holy Week. Payag ba kayo? Because you mentioned the role of travel dito sa pagkalat ng mga Payag ba kayo?
I think voluntarily, all of us can actually pledge to, sabi nga, di ba, a voluntary community quarantine, no? That means us staying home, enjoying it with our family, and really lessening our contact rates with other people.
Okay, Dr. Beverly Ho of the Disease Prevention and Control Bureau and also Director of the DOH Health Promotion and Communication Service. Dr. Ho, maraming salamat po for joining us tonight.
Thank you.
Ingat po.
Thank you po.
We'll just go into a break, so please stay with us.
Welcome back, the Chiefs, here on One News. We continue our conversation. Now with us is Dr. Maricar Limpin, Vice President of the Philippine College of Physicians. Good evening, Dr. Limpin.
Good evening po.
Yes, good evening to everyone.
Doc, I'm sure you've heard the latest projections from Okta. They've upped their projections to 8,000 na by the end of March. And more alarmingly, they're seeing kung walang magbago, 18,000 by the middle of April. Doc, is it time? Same question we asked Dr. Beverly Ho. Are you anticipating a call from your sector for another timeout?
We have actually discussed that among ourselves, and we believe that now is not the right time to call for a timeout or to call for a total lockdown. No? Maybe what we are doing now, the granular lockdown, will be advisable para doon sa mga lugar o communities that will really have a very high number of COVID cases. So granular lockdowns will be okay, but yung total lockdown, we are still not going to call for that at this particular time, no? Not now.
Apa, ito not technical, but I want to continue yung tanong ni Ami kanina kay Dr. Ho, and we've been asking our resource persons also ever since Dr. Guido David brought it up from Okta Research. The idea, the proposal for not a lockdown, but a voluntary 2-week Holy Week. 2 Holy Weeks. How does that strike you?
Well, sa amin naman, kung voluntary, no, that means mga tao ang hindi lalabas. Okay? So, I would actually say, our recommendation for those people na wala naman talagang importanteng gagawin sa labas, might as well not go out anymore. No? Whether 1 week, 2 weeks, actually, for many months siguro, we need to do this, yung voluntarily not going out, kung wala naman talaga tayong dapat na gawin sa labas, no? So, ang dapat lang lumalabas talaga, yung meron talagang gagawin, no? Like maybe kung magpupunta sa trabaho nila at saka yung mga bibili ng mga essentials na pangangailangan ng bahay, yun lang yung mga lalabas. Pero yung karamihan, lalo na yung mga bata, yung mga matatanda, unless yung mga matatanda pupunta at magpapatingin sa doktor, then they can go out. Pero kung wala naman na ibang gagawin, wag na ho tayong lumabas. I think yun ang pinaka-safest. Well, not just for 2 weeks, but for the next few weeks, no? Talagang habaan na ho natin yung pasensya natin.
Pero Doc, kung ibahin natin po na, kunwari hindi voluntary yung 2 weeks na, kasi ang Holy Week naman talaga, hindi naman talaga voluntary yun eh. Hindi ka papapasukin talaga ng mga opisina for so many days eh. Kung hindi siya voluntary, kung for example, ipasuspend yung work for 2 weeks, o short of an ECQ, short of an ECQ, no government offices, essential offices lang papasok and all that, how does that strike you for 2 weeks? Or would that be too extreme pa rin?
Baka po kasi hindi rin, wala rin papayag na business establishment na magpapa-impose ng no work, no, for the next 2 weeks. That I think will be the question, no? Kung merong mga industry na gugustuhin magtawag ng no work, no? I don't think na yun ay mangyayari because ang tingin ko ay yung mga opisina, yung mga essential work na kailangang puntahan, pupunta at papapasukin pa rin nila yung kanilang mga empleyado. So I think ang pinaka-importante talaga ay sumunod lang tayo doon sa voluntarily na hindi tayo lalabas kung wala naman talaga tayong dapat gawin sa labas.
Kung ang gawin yung travel restriction, kasi ang movement during Holy Week, yung bakasyon, di ba? Kung yun ang i-restrict, yung movement, yung pamamasyal, yung gano'n.
Magbuburakay mga tao sa
Hindi naman, yung pagbibisita sa iba-ibang, pwede ka namang magbisita iglesia within your city. Halimbawa, lalabas ka ng konti ng Metro Manila o sa probinsya. That kind of restriction, you think that will help? Kasi 2 weeks lang naman actually, yung essential work, tuloy-tuloy kahit Holy Week. Kung i-extend lang yung mga restrictions sa movement, from Holy Week, bali madadagdagan lang siya actually ng mga 10 days from Holy Week.
Yes, ang recommendation actually namin ay strict entry and movements, no?
Yeah.
Via public transportation system. So siguro ang inaano namin, i-restrict siguro sa less than 30%, no? Yung mga sasakay ng eroplano, sasakay ng mga barko, ng mga buses, light railway transit, no? And mga jeepneys, bus, lahat yan, i-restrict sa 30% ang capacity. Kasi right now, hindi naman nasusunod yung physical distancing eh. And that is why ang dami ang nahahawa, no? So our transportation system is not safe. Kailangan ma-maintain natin na ang transport system natin maging safe for traveling. Then secondly, that is right also. There should be also a restriction in the movements, no? So therefore, gusto sana namin i-apply na hindi yung per community, per province yung regulation na whether mag-expect sila ng negative RT-PCR o hindi. No, siguro kung kailangan gawin, lahat na lang, yun gawin na lang na mag-require lahat ng RT-PCR. Kasi pag ang mga tao pupunta from province to Metro Manila, no restrictions at all. No, walang hinihingi na requirements. Pero pag lalabas doon sa ibang probinsya, merong mga hinihingi na requirements. I think ang isa sa magandang pamamaraan is make standard intervention na i-apply sa lahat ng local government units. Para sa ganun, hindi nalilito ang mga tao. Lahat alam nila, pag pupunta sila sa isang lugar, kailangan nila ng certain requirements. No? Hindi yung bigla na lang sila makakapunta. Nakakalipot nga kahit government official. Kasi hindi nga standardize yung mga requirements natin sa pagpunta-punta sa mga iba't ibang lugar.
So, paano yung mga non-COVID cases? Kasi syempre natatakot na naman magpunta ng ospital yung mga yan. Tsaka magpakonsulta sa doktor yung mga yan. Dahil nga on the rise na naman. So, what kind of, I don't know, improvement in service or pati yun, mahuhold na naman pa ngayon? Are we gonna be seeing more, sabihin na natin, deaths arising from non-consultation, di ba? With physicians.
Yes, actually, we have been seeing that already for the past few months. Marami talaga ang dumadating sa amin na medyo huli na, kaya marami talaga ang mortality na nakita namin from non-COVID, no? COVID-related in the sense kasi dahil sa COVID, hindi sila nagpapakonsulta. Pero non-COVID ang cause of death. So, marami talagang ganyan, no? And that is why, number one, kung talagang kailangan matingnan, no? Kasi talagang may mga instances na hindi pa pwedeng hindi sila tignan. Pumunta sila sa ospital, pumunta sila sa kanilang mga doktor, no? Meron naman mga clinics yan na open, no? So, nag-open na kami. So, there is no...
I mean, what assurance can you give them that they will not be infected when they enter a hospital or a clinic, knowing that the number of cases is on the rise?
Yeah, kasi dito kami, ako sa heart center ako, no? So ang hospital is separate, no, from yung mga clinic area. So, and then in the clinic area, bago ka pumunta doon sa clinic, talagang naka-triage yan, ano? Tinitignan namin kung sino yung mga may mga respiratory symptoms. Kung may respiratory symptoms ka, automatic yan, may pupuntahan silang ibang lugar. Hindi doon sa usual clinics ng mga doktor. Meron kaming designated na area na titignan yung mga may respiratory, tapos i-check namin meron ba silang COVID o hindi. Kung wala namang COVID, then they can go to their respective doctor. So, naka-triage lahat yan and carefully screen. So, as far as I'm concerned, no, the best place where you can actually go doon sa mga non-COVID, yung clinic area ng mga doktor. Kasi hindi basta-basta nagpapasok ng...
Pero Doc, okay yung clinic area. I can na-imagine ko yung clinic area ng doktor, di ba? But sa totoo lang, when we're thinking of, itakbo natin sa hospital, everybody's thinking of ER. Di ba? Yun yung tanong ko. Kasi yung mga ER, I think we all have the same image. At dami ko na nakitang ER, iba-ibang hospital, whether it's private or public. And I can't imagine social distancing. Na-manage ba yun? Are there protocols for social distancing even in ERs?
Yes, there are health protocols even in the ER. In fact, we have 2 ERs now, no? May ER kami for COVID and may ER kami for non-COVID. Magkahiwalay. So, hindi pare-parehas ang pinupuntahan. And that is why medyo naaayos talaga namin yung movements ng mga tao. Except probably, ang medyo mahirap lang talaga yung mga, kasi karamihan, kadalasan tayong mga Pilipino, maraming tayong kasama kapag pumupunta tayo ng ospital. Kaya sana nga yes, so we are actually limiting one companion only for each patient. Kasi yung mga companion, sila yung nagko-congest ng aming emergency room. No? So talagang nililimit namin. So yung mga kamag-anak, they remain outside of the emergency room. We do not allow them to go in.
Okay. Now, Doc, go ahead, Lucy.
No, kasi Doc, I mean, ang dami ko kasing kilalang halimbawa, nagpapa-chemo, no? And they're saying na mahal na nga ang chemo, magpapatest pa sila, tapos pati yung kasama nila magpapatest. So talagang na-imagine ko, yung mga hindi na maka-afford, di ba, hindi na lang talaga magpapa-ospital. Kasi kahit sabihin nyo na, of course, you're keeping it safe, no? But even that, the safety part of it has a cost.
Yes. Kaya nga, importante din, nananawagan din kami sa PhilHealth na sana i-consider nila na idagdag doon sa expense na i-cover ng PhilHealth yung mga RT-PCR na kailangang gawin sa mga pasyente na i-admit sa ospital. Kasi naturally, lahat ng pasyenteng a-admitin has to be negative, no? Para mailagay doon sa non-COVID area. Hindi kasi pwede kami magtanggap ng positive tapos ilagay namin sa non-COVID. Di ang daming mahahawang pasyente, no? So we cannot do that. So kailangan i-cover sana ng PhilHealth yon.
Doctor, kumusta naman yung sitwasyon ng mga doctors ngayon? Vaccination has started and one year into the pandemic, finally, ayan na yung mga bakuna, inuuna kayo. Your sector lost a lot of people at the start. Kumusta na ngayon? Kasi ngayon 1 year napupuno na naman daw yung mga hospitals, yung mga ERs, yung COVID beds, puno na naman. Kumusta yung sitwasyon nyo ngayon?
Yes, I think we're better prepared now in the sense na we know what to do. We know exactly ano yung mga pwede naming gamot na ibigay at ano yung mga pwede naming interventions na gagawin. But medyo marami talaga ang kaso ng mga COVID cases natin ngayon. Increasing not just among yung tao natin, yung mamamayan, but also even among healthcare workers, no? Kasi problema pag when we go out also of the hospital, hindi namin alam na expose yung mga tao doon sa mga asymptomatics o yung mga hindi nagsasabi na meron pala silang nararamdaman. So dito nahahawa yung mga healthcare workers. That's why we see also an increased number of healthcare workers, no? But right now, hindi pa kami humihiyaw, hindi pa kami nagsasabing time out kasi mas alam namin kung ano ang gagawin sa ngayon. So basically, we're really prepared for this and we're handling it as much as we can, ano, para sa mga tao. Para hindi kasi matatakot din ng mga tao kung kami magsasabi kagad na time out muna kami. Hindi na siguro mahirap gawin natin yan sa ngayon.
Yeah, and Doc, and we understand where you're coming from. We also don't want to cause panic, but at the same time, I just want to ask you, when you hear Okta Research raising its projections to 8,000 by the end of the month, 18,000 by the middle of April, how does that make you feel?
Siyempre, doon, medyo nakakatakot dahil iniisip na kagad namin na baka ma-overwhelm kami, no? Na hindi, ang takot namin, yung makita namin na hindi namin kayang tanggapin ang mga tao dahil sa punong-puno na kami. Wala na kaming paglalagyan na lugar para sa mga tao. Yun ang kinatatakutan namin. And let me just remind everyone, the main reason ng pag-increase ng ating COVID cases ay yung katigasan din ng ulo natin, ano? So hindi kasi tayo ang dami na talagang hindi sumusunod ng health protocols, lalong-lalo na ngayon sa transportation, no? Almost all transportation, including LRTs, are not are not instituting the right health protocols, yung physical distancing na wala na yan. And that is one of the main ingredient para maproteksyonan natin ang paghawa-hawa ng mga tao. No? And then of course, yung hindi magandang pamamalakad, hindi pare-parehas na intervention na ginagawa ng bawat local government units. Ilang beses na namin sinasabi ito, hindi pwedeng kanya-kanya ang gagawin ng bawat LGU. Dapat pare-parehas ang ginagawa ng lahat ng LGUs. And we want to emphasize this, no? Kasi yung implementation ng mga health stricter protocols na ito can only be done in the LGUs. At kung iba-iba ang gagawin ng LGUs, hindi tayo magiging matagumpay sa pagsugpo ng pandemya na ito.
Okay. Okay naman sa inyo, Doctor, yung pace ng vaccination, saka yung progress of vaccination anyway. Okay naman sa inyo.
I think it is being done as according doon sa priority listing ng Department of Health. Actually, nag-set sila yata ng deadline na sa lahat ng mga ospital dapat matapos within this day. And as far as our center is concerned, we're finished last Saturday. So natapos na namin lahat, no? Yung dapat naming bakunahan. Of course, may mga iba na hindi kasi nagkaroon ng COVID, so hindi na sila nabakunahan. But they will be able to get the vaccination after 90 days. So I think pupunta na tayo doon sa mga healthcare workers naman who are located in the community, no? Yung may mga private clinics, no? Sila naman ang susunod. And then after that, LGUs na. So actually LGUs na yun no, ang responsible doon sa mga healthcare workers na nasa community.
Okay, Dr. Maricar Limpin, Vice President ng Philippine College of Physicians. Ma'am, maraming salamat po for joining us tonight at ingat po kayo parati.
Yes,
Maraming
and
salamat
stay
po.
safe everyone.
Stay safe po. Okay, and now joining us for the final stage of our conversation is PNP spokesman, Police Brigadier General Ildebrandi Usana. We bring him in because just an hour from now, well actually less than an hour, 40 minutes from now, the entire NCR will again be under unified curfew from 10 p.m. to 5 a.m. The PNP is deploying more than 9,000 policemen across Metro Manila to implement the curfew. The PNP will also be setting up more than 300 checkpoints. What in particular will the police be looking for? Well, let me turn it around. Sino yung huhulihin at sino yung papayagan?
Sir, good evening po.
Good evening po.
Good evening po.
Meron na po tayong naipalabas na pronouncement, base na rin po sa naging press release po ng ating OIC-PNP, si General Eliasar. Yung pong mga essential workers pa rin ho, no? They are supposed to be the authorized persons outside their residence. At nakikita naman ho natin, ito na rin yung mga tao na usually tuwing gabi ay nagtatrabaho pa rin. Ito po yung mga medical professionals, may mga responsibilities sa iba-ibang mga hospitals, mga quarantine facilities, yung pong mga ambulances, mga drivers nila.
Yun po, given po yun. Given po yun. Mga health workers, given na ho yun eh. Pero yung iba po, for example, yung mga nagtatrabaho, yung mga pauwi sa trabaho, yung mga call center agents.
Mga nagbabalita na 9:30 pa lang aalis sa studio.
Kasi po, tanda po ninyo.
Kasama po sila, sir.
Last year
mga
po,
media practitioners.
last year po kasi may IATF ID cards na binibigay pa eh. I suppose this year, wala naman eh, dahil walang inisyo na bago eh. So, paano po yan? Pagdating sa checkpoint, how do you prove that you can still be out?
Sa implementation po kasi ng strict enforcement ng minimum health protocols, ni-require lang na sila ay magsuot ng kanilang face mask, face shield, pati na rin yung minimum physical distancing. No? Although doon po sa mga iba pang mga tao, other than the required medical professionals, meron po yung mga nagtatrabaho sa gabi, construction workers, mga media practitioners na merong beat sa gabi. Meron din po tayo sa mga call centers. Meron din po sa mga yung tinatawag na nagpo-provide ng delivery ng mga goods and services sa gabi. And of course, yung pong mga construction workers at the same time pang mga miyembro ng security sector Bureau of Fire, AFP, jail, and all that.
General, pagka po ba, ano po yung protocol? Pagka, let's say, late at natigil, let's say, natigil sa checkpoint, ano po ba usapan doon? Huli na ba kaagad yun? Ano pong, what can we expect? Let's say, ako yung ginabi, and for whatever reason, whether I have a legitimate reason or not, what can I expect? What can I demand?
What do you need to present?
And what do I need to present?
Well, simply yung ID lang po, no, na sila ay isang employee ng isang kumpanya na nagkakaroon ng trabaho for a particular period of time between 10 and 5 a.m., no, 10 p.m. to 5 a.m. Of course, wala naman pong kailangang hulihin kung wala ding violation. Although yung experience kasi last year, masyadong naging mahigpit ang ating mga kapulisan dahil wala talaga pong mga movement, no, may lockdowns and all. Pero ngayon, nag-reopen pa rin naman ang ekonomiya natin. We do not want naman na kami po ang magiging cause ng trouble for all our people na naghahanap buhay din lamang. No? So ang gagawin lang po dyan, kung sakali man po itong mga constituents nila ay nasa labas at meron silang authority para sila ay makapagtrabaho, hindi naman po sila hulihin. Pero ang mga checkpoints po natin na nakadeploy sa different areas, pag nagkaroon po ng curfew, stop and go lang po yung mga sasakyan, titignan lang po kung sino yung mga nasa loob. Hindi naman po sila huhulihin kung sila naman po ay magkakamag-anak o magkakapamilya. Pero make sure lang between 10 p.m. and 5 a.m. wala na po sila sa kalye. Kung sila naman po ay merong mga violations, depende naman po yan sa local government executive. May mga mahigpit po ng mga local government units, meron naman po maluwag, titignan po natin kung paano i-adjust ng mga kapulisan. Pero definitely, wala na po yung mga dating ginawa na pinagpipila, dinediretso sa sementeryo, o kung ano-ano pa mga gawain na hindi po naayon sa karapatan-pantao ng ating mga mamayan po.
Ano na ngayon yung sistema, General? Kapag you are apprehended, dadalhin ka ba sa presinto, sa barangay, or you will be reprimanded right there? May uniform protocol ba doon kung anong gagawin sa'yo? Halimbawa ako, uwi ako ng alas 11. Or yung mga walang authority, kapag gano'n. Meron bang standard? Kahit sa Metro Manila lang.
Ganito po, ma'am. Ang batayan po namin para mag-deploy ng mga kapulisan is strictly enforce the minimum health protocols. However, dahil sabi nga ho natin, hindi naman ito katulad ng last year. Kung napakarami hong mga tao at may mga violations, I guess siguro we need to refer back dun sa responsibility ng mga mamayan ho natin. Ayun naman ho natin na every now and then may mga apprehensions, may mga magko-complain na naman at magbubumerang din po sa ating mga kapulisan, bagamat ginagawa din lang nilang trabaho nang naayon dun po sa kautusan na kailangan strictly enforce. So kung sakali man, hindi kahit na lang po namin ang mamamayan, ang una po talaga is pagsasabihan lang sila, i-remind, i-warning. Pero kung talaga pong may mga constituents po at talagang mga mayors nagbigay na po ng kautusan, pahigpitan palalo, then wala po kami magagawa kundi pagmultahin sila or i-recommend sila kung sakali man sa munisipyo na sila ay magbayad base po doon sa tinatahana ng ordinances po.
Sir, meron na bang directive na mag-house to house or to go directly to households kapag may nag-report na may positive doon or prospective na positive? Meron na ba kayong mga ganun?
Noong unang panahon, na-designate po ang police for the contact tracing, remember ma'am, but it was the DOH officials, yung local social or other health workers, ang siyang nagsagawa. Nag-support lang po kami just to provide assistance. But up to now, wala naman pong ganyang kautusan, and we are not expecting as well na may mga house-to-house kami dahil supposedly ang deployment lang po namin in general, doon po sa mga streets, doon po sa areas of public convergence, and we're not really expecting na dadami po ang mga mamayan ngayon dahil medyo cautious na rin siguro ang mga mamayan because of the spike ng COVID-19 infections.
General, I hope you don't mind. One of the concerns of the public also, of course, is kung uniform standards for everybody. And napag-usapan na naman to because of Oriental Mindoro and General de Bolsina's visit there. Let me ask you first, sir. Ano ba talaga yung nangyari sa Oriental Mindoro? Yung pagpasok niya, did he or did he not bypass the protocols in Oriental Mindoro?
He did comply, sir. Actually, ganito po. March 9, nagpa-swab test siya, intended for his supposed departure for Mindoro on March 11. He was negative po siya noon. So pagdating niya po sa Mindoro via choppers, bago pa lang po nangyari yun, nag-apply din po siya ng online registration doon po sa Calapan City. And the other one is yung application for travel confirmation pass. These two requirements, kino-apply po ng ating Chief PNP. Pagdating po doon sa regional headquarters, bago pa man po siya dumating, meron na po siyang swab test for March 11, intended naman po sa pagpunta niya sa Palawan. Kasi supposedly, hindi na siya babalik sana sa Manila, dediretso na po siya ng Mindoro to Palawan. But sometime, lunchtime po yata yun, lumabas po yung result at nag-positive po siya. So, dinesisyonan niya na bumalik na lang po siya sa Manila at mag-self-isolate. Dahil yung positive po niya, although asymptomatic, kailangan po niya i-comply yung protocol po sa ganitong bagay. So, nag-comply po siya. Wala po siyang nilapag at mismo ang Calapan City magpapatunay na meron po siyang compliance dun sa requirement na yon. Actually, yung sinasabi po ng Mindoro pagdating po dun sa port, ang gagawin lang naman po doon yung temperature test, pati na rin po yung compliance doon sa minimum health protocols like wearing face mask, face shield, at yung compliance po sa minimum physical distancing po. Yun lang po. Pero pagdating po sa swab test, it was the PNP itself that conducted that swab test doon po para kay Chief PNP at na-observe naman po yung physical distancing din po pagdating niya po doon sa area.
Kumusta po yung security escort niya? Kasi iba-iba yung report namin ngayon. Yung isa daw masama nangyari. Yung iba daw, hindi naman totoo. Ano ba talaga nangyari?
In particular, hindi po ako privy kung sino po yung mga nasabing nahawa. But ang alam ko namin...
Yung closing daw niya, namatay. I'm sorry to say that. Pero medyo magulo nga yung istorya.
Ano, ma'am? No, ma'am, hindi po niya close-in security yon. Yung po ay naka-assign sa NCR. Na-mention lang po yung pangalan niya because, well, apparently because of so many activities ni Chief PNP sa NCR, yung official pong yon may have happened to meet him, pero hindi naman po siya yung talagang close-in para kay Chief PNP po.
Okay. Pero namatay?
Namatay po siya the other day po.
Hindi nahawa sa kanya, hindi sa kanya nahawa si Chief PNP. Kumusta na po yung sitwasyon ngayon ni Chief PNP?
Okay naman po siya, ma'am. Nandun po siya sa Campran.
Recovering or ano?
Hopefully, makarecover po siya, pero meron po kasing protocol na within a certain period dapat naka-isolate po siya. And so far, wala naman po problema. Hindi naman po siya nagbibigay informasyon kung meron siyang nararamdaman kakaiba sa kanyang pangangatawan.
Okay, maraming salamat PNP spokesman Ildebrandi Usana. Sir, thank you for joining us and ingat po kayo.
It's sir.
Salamat po, sir.
Maraming salamat po.
God bless po.
And that'll be all for this Monday edition of the Chiefs. We hope what to discuss here will keep the conversation going. Now, before we go, a reminder to our viewers, mask on, wash hands, and stay safe, Philippines. I'm Edlin Gao.
I'm Mami Paminton of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Robbie Alampayan. We are One News.